Hello everyone, this is Athar Mansoor from Tracks. In this video, we want to talk about something many of us fear, cancer, specifically colon cancer. It's one of the most serious cancers we face today, but it's also unique. It has a weakness, a flaw in its design that gives us powerful advantage, an opportunity to stop it in its tracks. And that's what we are going to talk about today. Ladies and gentlemen, I have with me Dr. Raja Mehdi, a leading oncologist in the US. Dr. Mehdi did his medical residency at St. Vincent's Hospital at Case Western Reserve University in the state of Ohio and fellowship at Providence Hospital at the University of Michigan. He did his medical degree from the prestigious Aga Khan University in Pakistan. He was my classmate at US Oncologist in Lahore, and we had great times during our childhood days. So he's also my best friend, and I requested him to take time out of his busy schedule for this important discussion. How can we prevent colon cancer? Often before it even really begins. Colon cancer is the second leading cause of cancer-related deaths globally. That's a sobering statistic. But what if I told you that for most people, it's almost entirely preventable? What if a routine screening test could find and remove the very seeds of this cancer so it never gets the chance to grow? In the next few minutes, we are going to show you exactly how we do that and how can you take control of your health by understanding this remarkable process. Ladies and gentlemen, we'll do a series of videos on other preventable cancers as well with Dr. Mehdi. But let's come to colon cancer now. Dr. Mehdi, we have heard about colon cancer and I have shared some statistics about it as far as deaths are concerned. So can you please tell our audience what exactly is colon cancer?
Thank you, Athar, for inviting me on your program and giving me the opportunity to share my thoughts regarding colon cancer screening. So as you mentioned earlier, this is the second leading cause of death. A lot of them are preventable. So colon is the distal part or the latter part of our intestine where, the food nutrients are absorbed and the waste is then, excreted out of the body. So colon cancer starts in the lining of that colon. And for average risk patient, it takes anywhere between 5 to 10 years for that polyp, which most of polyp is a growth on the inner lining, as you would have a growth on your skin. And most of them are benign or are not cancerous when they start. But if you don't remove them over a period of 5 to 10 years, it can become cancerous. That's our opportunity to screen and remove them to prevent a lot of deaths. So to just give you an idea, globally, about 2 million people are diagnosed with colon cancer, and there are approximately 1 million deaths. That's about a 50% rate.
Very big.
It's a big number. In the US, about 150,000 people would be diagnosed and about 50,000 deaths. So it just kind of gives you an idea also that screening can prevent a lot of these deaths.
Right. So, Dr. Mehdi, again, as a common person, it becomes very, kind of surprising because cancer as a word or as a phrase is really something which scares us a lot. We hear about cancer and then we are like almost half dead after we hear this word. So you have told us about polyps and you have told us that how they over a long period, like 5 to 10 years, if you do not remove them, they can become cancerous. But again, as a common person, how can we really stop something so serious? Is it magic or what? What is exactly the process?
Well, screening tools, and they have been effective for a number of years. So, not all cancers have screening tools available, but this is one of the most effective tools that can be used. So the first step is to identify the possibility or presence of that polyp, and that can be detected with a number of simple techniques. The simplest one that's been in use as a initial screening is to test the stool sample for traces of blood. That's been in practice for a long time. And, the screening guidelines at this time, these are in individuals who are not having any trouble, who are feeling healthy and otherwise no problems in terms of any bleeding or any change in the stool habits. For those at 45, we recommend starting screening. And the gold standard being the colonoscopy, which we will talk about in a little bit in detail. However, simple tests, especially, in globally, if those facilities are not available in rural areas or underdeveloped, or developing countries, a simple stool test, a sample can be tested with a very inexpensive kit for traces of blood. And if that is positive, then, you can make the effort of having access to a facility that does the colonoscopy, which is essentially direct visualization of the lining of the colon.
Right. So, Dr. Mehdi, another question which was coming to my mind while you were talking is that how does this polyp transform into a cancer? Because my understanding, and I'll share an analogy with you and correct me if I'm wrong, that polyp can be compared to like a weed in a garden. And the weed in a garden may be a tiny weed. And then when it grows and it can, poison the entire grass or the plants. Is this analogy correct? And I want to understand, and I want the audience to understand that how does this polyp over 5 to 10 years, when it goes unnoticed, maybe because it's inside your colon and it's not visible and maybe the pain is not there, how does it really transform into something so serious? So something about that, please.
I guess the analogy can be used because, if you have a weed starting out, you take it out from the roots and you're good. However, if you let it grow, it will take over the surrounding environment, the trees or the grass, and take over the nutrition from them. So starts feeding itself. Same analogy, it can be true because most of these polyps, they have not, if you remove them early, they have not gone through the wall of the colon. So, if you think of colon as a pipe, it starts on the inside, but it hasn't gotten the chance to go through the wall. Once it does that, then it can get a hold of the surrounding environment, which includes your blood vessels, the lymphatic supply. And at that point, it has the capability of moving rather quickly through the bloodstream or the lymphatics to other parts of the body, at which time just removing that polyp or a mass is not sufficient. Then you'll have to go after, the seeds that have gone away from where the problem started.
All right. So now I think we come to my last question, which is about the gold standard, colonoscopy, which you mentioned. And I understand that you also have a family history of colon cancer and you yourself undergo this process. So can you please tell us about this process?
Can So essentially, it's a flexible tube about the size, the width of your finger, with a high definition camera at the end of it. And before the procedure, the colon has to be clean because if you have stool in it,
it's like the prep.
It's like the prep. So a day or two before, the doctor will tell you to stop eating or drinking. You can have clear fluids, and then they'll give you a liquid laxative that you
So it empties your
you
colon.
take.
It completely
Empties your colon.
Okay.
Yeah, and that's very important for the quality. Otherwise, you won't be able to see much. And during the process, it's not painful at all. I had about 3 or 4 myself. So the current guidelines, if you have a family history, my father was diagnosed at age 40. So 10 years before the youngest relative. So just in my early 30s, I started having them. And then the doctor will tell you based on if they find any polyps, whether to come back in 2 or 3 years or longer time. So just here, I'll take the opportunity to tell that the 10-year process from a benign polyp to a cancer roughly is for average risk patient who do not have a family history. If you do have a family history and there is some genetic alteration that is driving that process, it can go much faster. So within 2 to 3 years, that polyp can become cancerous if you are at higher risk. So that will be determined by the doctor. So coming back to the procedure, it's not painful at all. It's given under IV sedation. So there is no anesthesia, general anesthesia involved. Essentially, the nurse starts a drip that has a medicine that puts you to sleep. You're breathing on your own. There is no downtime. The process takes about 15 to 20 minutes and is completely painless. And
nothing to fear about. Nothing to fear.
Nothing to fear about. There's no downtime. You're a little groggy when you wake up, so the doctor will ask that you have a driver to take you home, but you're completely recovered at that time. And if the doctor finds any polyp, they will remove it. It'll go to the laboratory within a week or so. The results will come, differentiating between completely benign polyps, or you could have a polyp that has started to become cancerous. So the doctor will tell you that, if there is no polyp, they can bring you back in 10 years. If there was a polyp, depending on the type of polyp, they may bring you back in 1 year or 2 years. So that's the advantage of having direct visualization and sampling of that polyp.
Great. So viewers, knowledge is the first step, but action is what saves lives. The most important thing you can do now is to start a conversation. Talk to your doctor, as Dr. Mehdi has pointed out. Discuss your personal risk factors. He himself has pointed out how his father was diagnosed with colon cancer at the age of 40. And decide together with your doctor which screening test is right for you and when you should start. Colon cancer is Yes, Dr. Mehdi.
I would like to just, point, a little trend that's, for which we do not have any screening guidelines yet.
Right.
So first that, with the colonoscopies, the risk of death can be prevented or brought down by 80%.
Right.
So if you take that 1 million number, ideally, it's almost impossible to have, perfect screening in globally, in different societies. But think about saving about 800,000 lives a year globally.
That's
so
a very big. That's a very big number.
Big number. Now, one set of population that is kind of evading these screenings at this time is that the number of deaths in elderly or 50 plus, I should say, is declining in the US, or at least in the developed countries. However, there is a surprising increase in younger population with very advanced colorectal cancer, which we have really not figured out the reason for. But the number one thing that comes to mind is the increase in processed foods, which is significantly high, in developed countries too. So I'm talking about patients in their 20s and 30s with no identifiable family history or genetic, reason for it. coming with very advanced cancer. So the message would be that as a young person, if you have significant changes in your bowel habits, please do not ignore it. You're not immune from getting cancer, and the screening guidelines are not yet developed in that population. So we have to be, very aware of changes in our body, specifically related to digestion, that should not be ignored.
All right, all right. Thank you so much. Thank you, Dr. Mehdi, for identifying and pointing out this fact which you have witnessed recently. And this is, I think, recent phenomenon, viewers, and he has very skillfully highlighted the issues which the younger population can face. And despite that they do not have any family history or any genetic risk, but they are still prone to this deadly cancer, which in fact is preventable, as he has pointed out. Dr. Mehdi, thank you so much. I understand you are a very busy person. You have your own practice and you are always very closely associated with your patients. You take personal interest in all your patients, and I've seen you over the years grow into one of the finest oncologists in the US. I'm so proud of you. And as our viewers identified, he's one of my best friends, and we have spent such lovely time together in our teenagers. And I'm so proud of you, Dr. Mehdi, again. Ladies and gentlemen, viewers, we are going to come up with another video on another preventable cancer with Dr. Mehdi sometime very soon as he finds time. And thank you so much for watching this important video. Try to take it very seriously. Stay tuned for more. Join Tracks.